Milwaukee is in the grip of an alarming lead crisis, with some of its most vulnerable residents, black and brown children, on the far north and south sides of the city being hit the hardest. Public health experts call this a tragedy that allows inequities and even crime to fester. Research by the UW-Milwaukee Zilber School of Public Health finds black and brown children in the city are disproportionately at risk due to lead paint and sometimes water in older homes in their neighborhoods. In our latest 360 report, we go beyond the traditional two perspectives offered in a news story and explore the situation by interviewing four unique perspectives that converge on a crucial truth. A medical director, public health professor, radio show host, and grassroots organizer, all sounding the alarm about the dangers of lead exposure and a need for us to demand solutions.
It's more than perplexing to me that all these years later, that we're still dealing with the paint exposure.
This is Earl Ingram, soon turning 71. He's born and raised in Milwaukee and now uses his radio platform to highlight critical issues affecting his community, like the city's ongoing lead crisis in schools and in homes.
It is clearly a lack of leadership.
He wonders how the wealthiest nation on earth is moving so slow to find, fund, and execute solutions to the lead that is poisoning Milwaukee's kids, and calls upon elected officials to make fixing the issues a priority.
Being elected is one thing. Doing what's necessary to protect the children of this nation is altogether something different.
And as Dr. Heather Parody, the medical director of the Integrated Lead Program at Children's Wisconsin, says, not addressing the issues rapidly will have serious impacts.
Exposures over time can lead to growth delay, can lead to learning difficulties, decrease in IQ, can lead to more aggressive behaviors. And so those can certainly have impacts that can be lifelong.
Dr. Parody points to data that shows black and brown children in our city are most at risk of lead poisoning.
Unfortunately, Milwaukee is not only a segregated city, but a hyper-segregated city. So we do see the majority of lead poisoning burden existing within our near north and near south side communities, which are children of color, children who are living at or below the poverty level, and children who may have other social vulnerabilities.
While reporting on this story, I learned that the risk of lead exposure could be leading to other societal issues as well.
We looked at lead exposure to children living in Milwaukee, and we were able to link this up with criminal records of being either a perpetrator or a victim of gun violence. And we did find that the more lead, the more likely someone was to either commit or be a victim of a firearm-related crime.
Amy Kalkbrenner is a professor of public health at UW-Milwaukee's Zilber College of Public Health and says lead exposure and crime go hand in hand, which is why she believes intervention must come from outside the home.
We have to lift our gaze from, family by family by family level solution to a societal level solution. It's almost as if there's a price tag to being in a safe environment, expecting people to handle these things on their own, and that's simply not fair. So it comes to an issue of justice.
She agrees with Earl that local and federal government must step up and offer incentives, solutions, and support to those most impacted. Meanwhile,
so we're going to do 480 of these, and this actually hooks up underneath the sink to like the water line.
Melody McCurtis, the deputy director and lead organizer at Metcalf Park Community Bridges, is just one example of a neighbor bringing forth solutions and resources while waiting for clearer answers from elected officials.
Black and brown communities are really suffering and paying the most, not only with their pockets, right, and their limited resources, but also their health. And all of these things are interconnected.
She and her crew have been going door to door, working to offer water filters to some of the community's most vulnerable families, offering at least some peace of mind and, more importantly, education about the ongoing crisis, something neighbors like Earl hope more people take seriously.
So it is incumbent upon people in the community to step up. First, to be educated, and then to bring the pressure necessary on the elected officials, that they understand that this should be priority one.
And I want to thank all of those people there for sharing their perspectives with me. My report tonight is the latest from TMJ4's Lighthouse team, which is dedicated to in-depth reporting on issues impacting Southeast Wisconsin and holding officials accountable. Scan the QR code here on your screen right now or go to tmj4.com/lighthouse to see more.